Hi, my name is Ishani. I'm a second year medical student from IMU, currently studying in ME 123 cohort, and I'm in semester 3. So today what I'll be doing is I'm going to be giving a book review on the Principles and Practice of Surgery, 8th edition. So before I tell you what I like about this book, let's go through a brief overview of it. So this book, it discusses the core principles of surgical practice, and it offers a lot of comprehensive exploration in anatomy, physiology, and a lot of surgical techniques in various different specialties. So for example, we have cardio, urological, neurosurgery, we also have transplant. So in all these different specialties, we'll look closely at the different investigations and different surgical procedures that they will have. What I like about this book in particular, is that it offers a lot of clinical photographs. So these clinical photographs sometimes help us visualize and understand many difficult procedures much simpler and much easier, and this is what I like about this book. Another reason why I would recommend this book to IMU students is because this book contains a lot of what we learn and a lot of our curriculum, but it discusses it in much detail. So I'll take an example. In semester 3, we learn a lot about the gastrointestinal tract, and for example, the chapter acute abdomen covers actually most of our AG1, or the first part of our semester. For example, now I've already learned about somatic pain and visceral pain, and this book actually dives deep and gives you a much clearer and much deeper explanation to help your understanding. And sometimes in classes like PBL, we've also learned about peritonitis. So this book would be extremely useful to IMU students because it will help you do your research and give you better understanding on these topics. Another reason why I would recommend this book to IMU students is because after you learned about the theory, you are able to bridge your learning to your practical and find a link to your practical or clinical skills as well. So for example, here you can see we have clinical assessments, and after this book has discussed diseases like peritonitis, it also goes into the clinical assessments. So you are able to see, for example, in your clinical skills classes, you are able to see and briefly go through like the history. So what kind of questions should you ask? And it also describes, this book also describes the findings that you'll find in like physical examinations in much detail. So it helps you understand better sometimes why are you performing certain tests or certain procedures. So in conclusion, I feel that this book is really helpful to IMU students because not only does it provide pictures that help us, many pictures as you can see, that help us visualize and understand certain difficult terms or difficult procedures better, but it also has it contains a lot of our curriculum that will help us deepen our understanding and also find a link or a bridge between our theory and also our clinical. And this would help us a lot going into OSCEs or final year exams because we've already understand these topics much into depth. And if you are interested in this book, you can always refer to our librarian at the IMU library. I hope to see you again soon. Thank you.